Hello, my name is Michelle, and today I will be discussing a healthy pregnancy. The first thing I'm going to do is I will check provider orders and see who my patient is, and I will go to her room and introduce myself. Knock, knock. Hello, my name is Michelle, and I will be your nurse today. Can I please have your first, last name, and date of birth? Thank you so much. I'm going to go ahead and provide privacy and perform hand hygiene. So, I am here to discuss a healthy pregnancy and different talking points about your pregnancy and what steps you should be following in order to have a healthy pregnancy for you and your baby, okay? So, the first thing I'm going to discuss is your appointments. Your initial appointment will be the longest one, and that is because we need to draw a lot of labs to ensure that you have proper nutrition, you're not deficient in any kind of vitamins that need supplementation. We want to rule out any STDs or STIs that you might have, and additionally, just ensure that you're overall healthy. We're going to do a physical, we're going to do a mental health screening, and just a overall history of your health to ensure that you and your baby are safe. Another thing you could expect is an ultrasound. Your first ultrasound will be at about 7 to 8 weeks, and we will continue to do ultrasounds to ensure that your baby is developing normally. And if they are not, we would have to address that, and that is why we do the ultrasounds. And at about 20 weeks, we begin to measure the fundal height, and that is the measurement from your pubic bone all the way to the top of your fundus. So it should correlate to how many weeks you're pregnant. So at about 22 weeks, your fundal height should be a little above your umbilicus. So another thing I would like to discuss is healthy foods that you should be eating and supplements that will fortify you and your baby. So the first thing I would suggest is a prenatal vitamin. And a prenatal vitamin will ensure that you have all your vitamins and minerals that your baby needs in order to grow fully. Some mothers who do not take it, their baby may come out a little bit smaller and can be premature. Additionally, another thing I would recommend is a DHA supplement. That is very important for the baby's brain development. And another important thing to be consuming while you are pregnant is iron. So iron will be supplementing you and your baby. Since you are making a baby, you will need more red blood cells, and iron stimulates red blood cell regeneration and growth. Another thing that I would like to discuss is exercises that are and are not allowed. So the first thing I would like to say is first ensure that you are having a safe, healthy pregnancy. Make sure that you are not having any complications with your doctor prior. Now, if you are an experienced exerciser, let's say you've been running your whole life, you could do some light jogging and walking. You can do yoga, stretching, what else? Very light dumbbell exercises. And now I'm going to discuss exercises that are dangerous for you and your baby. So exercises like racquetball, horseback riding, surfing, skydiving, anything rock jumping or very jerky sudden movements are very dangerous to you and your baby and can lead to harming your baby. So just make sure that you're doing safe exercises that are not hurting your baby, okay? Another thing that I would like to discuss is weight gain. So the first trimester, every woman should expect to gain approximately 2 to 4 pounds, and then after that, I'm going to be discussing if you are underweight, you should be gaining approximately 1 pound per week. If you are normal weight, you should be expecting to gain 1 pound per week. If you are overweight, you should be expecting to gain 0.6 pounds per week, and if you are obese, you should be gaining 0.5 pounds per week. So I do understand that cravings are that pregnant women do get cravings, but this is, I have said this before, this is not a meal or an excuse to indulge in many sweets and all of your cravings. Remember, you are pregnant, and if you, and that puts you at risk. Pregnant women are at risk for developing gestational diabetes. So you want to make sure that you're eating high fiber, high protein, a lot of fruits and vegetables in order to maintain a healthy weight gain, and that will fortify your baby. Another thing I would like to discuss is a few complaints that pregnant women have issues with. So the first one will be urinary urgency. So urinary urgency is very common because the uterus is pressing up on the bladder. So the one thing I would suggest is to have regular, empty your bladder regularly. Another thing I could suggest is to wear a panty liner in case you do happen to have a little accident. You just have a little panty liner there to protect you. Additionally, I would recommend to do Kegel exercises that will fortify and strengthen your vaginal muscles. And lastly, if you're going to bed, I would suggest not having any liquids prior to bedtime. That way you're not getting up at night and having to go pee-pee at night, okay? Because that can get a little annoying. Additionally, I would like to discuss something more important. So I want to discuss some warning signs and what you should do and what those warning signs are. These are very serious warning signs, and if you experience any of these, you should call your doctor or seek medical emergency immediately. So the first thing I'm going to say is abdominal cramping, severe abdominal cramping and bleeding. That could be a sign of placental abruption or a miscarriage, and you would need to seek medical help immediately. Additionally, if you are experiencing fever, chills, and vomiting, that could be a sign of a serious infection, and it would also be very important to go seek medical attention immediately. And lastly, if you are in your second trimester and your baby has been very active, and if you suddenly notice no activity, that is also very concerning because that can mean that maybe the baby is fading or maybe the baby has died. So if you are not seeing any kind of activity and prior your baby was very active, you would want to seek medical attention immediately. Okay, and did you have any questions for me? Very good. And I'm going to go ahead and give you a few printouts and a few additional resources that you could look into if you ever have any questions or concerns. Okay, thank you very much.